भद्रं कर्णेभिः
भद्रं कर्णेभिः
शृणुयामदेवाः
शृणुयामदेवाः
भद्रं पश्येम
भद्रं पश्येम
अक्षभिर्यजत्राः
क्षभिर्यजत्राः
स्थिरैरङ्गैः
स्थिरैरङ्गैः
तुष्टुवागुंसस्तनूभिः
सुष्ठुवागुंसस्तनूभिः
यशेम देवहितं
यशेव देवहितं
यदायुः
यदायुः
ॐ शान्तिः शान्तिः शान्तिः
ॐ शान्ति शान्ति शान्तिः.
Let us see everything auspicious, the divinity in everyone. Let us hear everything as the manifestation of divinity, that all our organs and systems, the body, mind, emotions, everything be tuned to that ultimate reality, the pure consciousness, and let there be peace inside, peace outside, peace throughout the world. That's the beautiful Shanti mantra given by this thing. My dear brothers and sisters, yesterday we had a glimpse about the yoga therapy as to how it can help in controlling hypertension and the research that we have done, and also about the Niyantrita Raktadapa project that we are taking up throughout the country, a pan-India study to see how hypertension can be brought down, the prevalence can be brought down, and we can prevent hypertension through the yoga programs. And we had Dr. Amit also talked about the basic aspects as to how hypertension can hit various organs and systems in the body and others. The integrated approach of yoga therapy works not only at the body level, at the prana level, mind level, emotional level, intellectual level, and all the Panchakosha level. And it's in the Manomaya Kosha, the Adhi starts and comes down to the physical body becomes a Vyadhi. Unless we remove the Adhi, Vyadhi cannot be completely eradicated. Therefore, the whole approach of yoga is to see that we work at all levels to see that we will be able to deal with this thing effectively. So, it is a combination of the modern medical system with the yoga or the Ayush system that we have adopting, that is the integrated approach of yoga therapy, integrative medicine, we are trying to bring it into fore. With that background, yesterday we had discussed various things with number of questions and answers, and then we had a brief thing about our practice. Today, we are really very happy that we have one of the topmost cardiologists in the country, and Dr. Manchanda ji, who was the professor at AIMS, Delhi, and he had trained large number of cardiologists in the country. Whoever has come up so big in the country and abroad are all his students. So it's really very, very fortunate that Manchanda ji has been able to give time for today, and we will request him to come and give his presentation as to how hypertension is growing as the biggest menace in the world, and how yoga he has been using as a lifestyle change to bring about the changes in the hypertension, and he is one of the topmost leaders in the country. As I mentioned yesterday, the National Research Advisory Board consists of Dr. Manchanda also as one of our key advisory board members who will be involved in this pan-India hypertension control program. With that brief introduction, I request Dr. Manchanda to
Thank you, Guruji, for this kind introduction. As you heard, I am a cardiologist I was working in All India Institute of Medical Sciences for 45 years. I retired 20 years back, and now I'm working in Gangaram Hospital. But I have been interested in yoga research for the last about 30 years and all. And under the direction of Guruji, we have done lots of projects. We are still doing a number of collaborative projects. One of them is the largest project ever in heart failure. Today, but I'm going to talk about the biggest public health problem of the world, that is high blood pressure. High blood pressure or hypertension is really the biggest health crisis in the whole world. And every third person, there is a study done from ICM which shows that 35% of people in India, this was about 6-7 years back, are suffering from this disease. When your blood pressure is more than 140/90, this is called high blood pressure. And there is another term called pre-hypertension or high normal. If your blood pressure is more than 120/139, it's called high normal blood pressure. 50% of these people can also develop high blood pressure. So the number is huge. I would say 60% of people are at risk. And although it's a big problem, but there are problems. People are not even aware of it. That's why WHO has called it silent killer. Even if your blood pressure is 180/190, you will be having no symptoms. So this is a dangerous disease, and WHO rightly called it a silent killer. And therefore, it's, I think, mandatory for everybody to know his or her blood pressure from the age of, say, 12 years or so, because this is prevalent throughout the world, and as the age advances, it increases. In the Western countries, it usually occurs mostly above 60. Say at 60, they say 60% have this disease, at 70%, 80%, and so on. But in India, we have peculiarities about this. One is that this occurs at a relatively younger age. Now we are getting even the younger kids, school or early colleges, because again, unhealthy lifestyle. I will talk about that in a minute, why it occurs. So it is occurring at a relatively young age. Then it is associated with other problems like diabetes, high cholesterol, and several other things. Obesity is increasing. A big problem is obesity. I call it the most dangerous disease because there is no treatment that we have. And patients don't think it's a disease, you see. So it's a very dangerous disease called obesity or increased weight that's associated with hypertension. So it occurs at a younger age. It associated with other diseases like diabetes. We have the diabetes and high cholesterol and other diseases. And thirdly, that some of these patients have so-called white coat hypertension. Maybe under a lot of stress, seeing the doctor, the blood pressure goes up. At home, it's normal. So that is important. Those people who do yoga, they don't have this. And this is something called masked hypertension. And with the doctor, they are normal, but at home, the blood pressure is high. So that is a difficult thing to diagnose. But we encourage people to check the blood pressure at home only, rather than coming to doctors. And also at home, if you check the blood pressure, then you will be able to find out whether you have high blood pressure or not. So, and the next thing is that people have high sympathetic tone. Heart rate is much higher. If with high blood pressure, your heart rate is high, then the chances of death are much higher. So, and this can be treated with many conditions, like some medicines are there and yoga and all. Now, why is this disease increasing so rapidly? It's increasing actually over the period of time. When I was in All India Institute long back, I was there for 40 years, we hardly saw patients of high blood pressure. Only at a very elderly age, some people used to get it, but it was not that common. It's increasing. And that's all lifestyle disease, so-called non-communicable diseases are all increasing. I'm sure you're aware of it. Earlier, communicable disease used to kill us, but now it is the non-communicable. And hypertension is number one. The reason is because our lifestyle has become unhealthy. It is called as essential. We don't know the exact cause, but there are various contributory factors. The most important is the food. You see, the junk food that the kids are eating. You will be surprised, these processed and refined foods are very dangerous. Processed foods have so much of salt. Even in the Western countries, people take pizza, burgers, etc. They are the most dangerous thing, and they put a lot of preservatives also, which can cause even cancer and all that. So I am very much against these so-called fast foods and all, because they kill you faster. I call it fast food means killing you faster. And this is enough fact, enough data. It's a lot of salt, lot of saturated fats are there, and there are chemicals which are there. So I think we should discourage children, or I would say the tax should be very, very high on these fast foods and all, because they're very dangerous. Not only they cause high blood pressure, they also cause heart disease, that is blockage of the arteries. They also cause diabetes, because you get a cola free with that. And sugar is, I think, one of the biggest killers and all. So anyhow, so I think the food is the most important part. And excess of salt. In India, we take a lot of salt, much more than what we need. And there's a WHO now sort of project to reduce salt by 25% by 2025. It's a huge, all over the world they have taken. And they believe that if you can reduce salt by 25%, the blood pressure will come down by 25%, and heart disease will come down by at least 20%. Because high blood pressure is one of the biggest sort of problems or biggest causes of several diseases. The most important is stroke. People get paralysis on one side and all, and we call it stroke. It can be embolic, there's a clot, or it can be hemorrhage can occur. Now this causes disability, and one of the most important causes of disability is high blood pressure, stroke. And if your blood pressure is more, the chances are much higher. The second thing is it causes heart disease, coronary heart disease, heart attacks and all, which is, you know that it's a killer itself. It also causes heart failure, that heart can fail. This means blood pressure, the heart function can come down and all. Then it can cause various other things in the arteries, for example. It can damage the kidneys and all. So most important cause for kidney disease, which is kidney failure, is also one of the very important causes. You must have heard people getting for kidney transplant, dialysis and all. Huge number of patients are there, and this is the most important cause. And if diabetes is associated, then it is much worse and all. And it can cause the blockage of various arteries, etc. And it can cause even what we call dissection of aorta. If you know Pandit Nehru or previous prime minister, dissection of aorta, it could not be treated because the aorta ruptures over a period of time. So I think this is a very serious disease. It causes not only, although it's a silent killer, silent disease, but over a period of time, it can cause these complications. Now, it can be easily treated also. There are a large number of medicines available, but there are a large number of so-called lifestyle measures, which I'll discuss in a little more details. But unfortunately, the drug compliance is very, very poor in our country. It's poor all over the world, but in our country, it is very, very poor. Actually, there's a paradox of 50%. It seems that all the people, hypertension is so common, more than 50% are not aware that they have high blood because they never get it checked. And those who have high blood pressure, they never get the treatment because they think they are normal. Those who get the treatment, they also don't take it properly. And adequate control of blood pressure, that means blood pressure coming down less than 140/90, is only 25% in the cities and 10%. So even if there are tablets, people don't take it because no symptoms are there. And untreated hypertension is as dangerous as having hypertension. It can cause all those diseases which I told you. It can cause stroke, heart disease, heart failure, kidney disease, and so on. So this is important to control it. But unfortunately, the drugs, our compliance is very poor. There could be several reasons. One of them is that patient doesn't feel anything, you see, and sometimes the side effect of the drugs, they say, I was feeling all right, now suddenly I've got complication. Every medicine has side effects now. We give calcium channel, which can cause edema, constipation, etc. I will not go into details of that. But I think the best way to treat is by lifestyle management, lifestyle, what we call it. Lifestyle means there are about 4 or 5 factors which are important. One is to improve the diet. I'll talk about it a little. One is to do physical exercise. Third is that there should be no mental stress. It's very important. And that the only method we know of is yoga and meditation, which can remove it. A huge number of studies are there. And fourthly is that one should avoid alcohol and tobacco and all. And I think in the diet, what is important is to show the plant-based diet, what we call it a vegetarian diet, has been clearly shown to decrease the blood pressure. There is a special diet called DASH diet. This was, Americans did a lot of research of this. This consists of fruits and vegetables 3 or 4 times. If you take fruits in the day, blood pressure will come down because there's high potassium and all that thing. And cutting down salt, as I said, 25%. Extra added salt should be avoided. And you should take, avoid these so-called refined foods. There are only 4 refined foods. One is sugar, is the biggest culprit. Sugar we think causes diabetes, but it causes high blood pressure also, causes heart disease also. Because it's refined. Good jaggery is all right, but don't take sugar. And sugary drinks are very, very dangerous. They also cause so many deaths. Apart from causing high blood pressure, they cause diabetes, as we know, heart disease and so on. And the second thing is that maida, the white flour. Whole wheat is all right, but maida should not be taken. All this bread, biscuits, etc., all the things which you buy in the market. So we always said don't try to eat from outside, eat at home. The whole wheat is all right. And these days, these days millets, if one can take millets in plenty, this is the, I think, cure for not only hypertension, for heart disease as well as diabetes and all. So those are very good. Similarly, white rice should not be taken, brown rice. Refined oil should not be taken. I have done a lot of research on that. It should be non-refined oil. You see, the best oil possibly is the mustard oil or canola oil, but it should be non-refined. This is called cold compress in India. Outside they call it extra virgin. Olive oil is also good. Canola oil is also good. Don't take anything refined. Everything we get in the market is refined. And one should, as I said, cut down salt as much as possible, 25%. So this, and a vegetarian diet, it's been clearly shown in non-vegetarian meat especially causes not only high blood pressure, causes heart disease, it also causes cancer and so on. So every recommendation of every association, whether it's Indian, American, European, they all suggest you should take plant-based diet, in other words, vegetarian diet, and avoid these too much of saturated fats, etc., from fried things, etc., from outside. So that is about the diet and all. So the second thing is physical exercise. You see, these days, because of a lot of use of this for telephones and the digital media, people are, I think, playing with it all the time. Physical exercise has come down. Not only that, the sleep has also gone. You see, lack of sleep is also a very important factor in causation of heart disease. And there is a disease called the sleeping called it is called obstructive sleep apnea, or OSA, and the people have a lot of snoring at night and then they get up at night and try to sleep in the morning. So that's a dangerous disease because this is a type of sleep abnormality, and if one gets it, then hypertension is very likely, even diabetes is more likely, and that can be treated. Even I will show you, some research has shown that yoga could be helpful in obstructive sleep apnea also. So the good sleep is very important, and it has been shown that if you take less than 6 to 7 hours, the chances of getting heart disease, diabetes are much higher. So lack of sleep is another factor which is very important in this, and that comes in the stress management. So physical exercise is important. Half an hour of brisk walking every day, or any other dynamic exercise. It can be cycling, it can be but walking is the best, which is absolutely key. And it should be done every day, 7 days a week. But people, as I said, don't follow it, because I think all these diseases that cardiologists I know, is lack of your willpower. See, I know many patients, I ask them, they are very educated, why don't you exercise? He says, doctor, I want to exercise. I get up in the morning, I want to change my clothes, but my mind says, don't have today. Yesterday you had a late night. Tomorrow you can do. Tomorrow never comes. I go to a party and my mind says, have a rasgulla today. Have this thing, not tomorrow. And that tomorrow never comes. Some excuse or the other. When we teach them yoga, etc., then I say, what happens? Why did you become regular? He says, yes, the mind says, don't go today. Tomorrow you can. He says, set up mind. So you are trying to control the mind. See, the idea is body, mind, and as I tell you that yoga is nothing but a sort of a good coordination between the body, mind, and consciousness. And if you can treat it, and the yoga can, as Guruji said, can control the mind also. So I think mind becomes strong. You know what are the reasons. I mean, these awareness has increased so much. Still, people don't follow it. You see, People know it's bad to be angry, but everybody gets angry. You know? So I think so. This is important. So exercise, physical exercise is important. And third thing, of course, one should not smoke, and one should not take alcohol. Alcohol is also one of the important causes of high blood pressure. About 10 to 20% of high blood pressure is because of excessive taking of alcohol, and alcohol is completely banned now. Earlier it used to be said you can take 1 or 2 packs, but now every association says even 1 drop is bad. WHO has clearly stated. So that should be avoided, and of course smoking, whether it's BDs or anything or chewing tobacco, all those things are bad. That everybody knows. Again, the control is not possible easily, but again yoga helps, I'll tell you in that also. And finally, obesity should be avoided. Obesity, as I said, is increasing, and if you reduce weight by about 5 kilos, the blood pressure can come down by 4 or 5 millimeters. And finally, the important thing is you should try to avoid stress, because stress is a very important factor. As I said, one of the causation for high blood pressure. You see, when you are stressed, the whole body biochemistry changes. The mind releases certain chemicals which are harmful, like adrenaline, noradrenaline, and other things, which can constrict the blood vessels. They can damage it also. They can cause heart disease, diabetes, and so on. So, mental stress is an extremely harmful thing, and this has been shown not only to cause high blood pressure but also heart disease. It can cause even sudden death. You might have heard people suddenly getting depressed, some bad news, or sometimes very good news also. A gentleman got a huge lottery of several crores and he suddenly died. So too much of extreme stress or change of mood can also cause it, and it's very well known. We have seen that a certain problem in the family can cause death and so on. It can cause even heart rate to be irregular. It can cause ultimately high blood pressure. So stress should be controlled. And I think the best way is yoga or meditation. You have Guruji and other people who will tell you in details about it. But as far as I know, I started my research about 30 years back on yoga. And when I started yoga, I asked the patients, can you do yoga with me? At that time, yoga was not that popular as it is today. 30 years back, I'm talking. They said, no, doctor, yoga is very difficult. They thought it is some complicated asanas. You can see on the photographs and all that thing. Sometimes I think that's a very bad thing which is shown. Some of the elderly people don't want to do it, or those are not very good. So I said, it's not a few asanas, but a complete way of life. That's to me. What is complete way of life? There are 4 components. It's a physical, mental, emotional, and spiritual component. Physical means diet is a part of yoga. You see, the vegetarian diet, as I told you, exactly the diet which is used for prevention of heart disease, diabetes, and high blood pressure. It's the same. So diet is a part of it. Physical exercise is a part of yoga. You see, many of these yogic asanas burn your calories, and this is equal to mild to moderate exercise. So it becomes exercise by itself. And finally, you should avoid tobacco and alcohol. That's also part of yoga. So I think these physical component, everybody agrees that one should take a proper diet, one should not smoke, and one should do exercise. So that is a physical part of it. The second is the mental. I think stress is a very important factor, as I said. And now a large number of studies have shown, these are all scientifically proven studies, which show that yoga can reduce the stress, and meditation. Any number of studies are there. PhD theses are written, meta-analysis and so on. Anxiety, depression, large number of studies are there. It's extremely useful. And that's why many people are doing that. You can remain stress-free. You can have a happy life with this yoga. It has to be done properly and all that. I always say in my stress management thing, only one line to my patients. I see a number of patients. I say there's nothing called stress. You create stress. Because your mind creates stress. Because life, as everybody knows, is not a straight line. It's happiness, unhappiness, success, failure. Now, if success occurs, we are not under stress because we think it's normal. But when failure occurs, we start having anxiety, depression. That's also normal. So yoga makes you sort of immune to outside things. Outside things we can't change. There are 7 billion people, we want them to change. Not possible. We can't change the weather outside. God has made something cold or hot weather, especially in Delhi. Sometimes it's very hot, sometimes very cold. People don't like it. They also get stressed. So you can't change it. So if you are not affected by hydrogen, you will never get stressed and all. People tell me that no, this gentleman gives me stress, my wife gives me, or my husband gives me. Not possible. They say things which you may not like, but they can't cause stress. If your mind does not take it, you will never get stress. So anyhow, so I think this is what yoga has been shown to be reducing the stress and all. I have seen in my own colony and my own patients, I have been now treating every patient of mine get some sort of meditation and marked reduction, and the families have changed. You see, there was a gentleman in our first study. His wife rang me up and says, "What have you done to my husband? He's not the same man." I said, "What happened?" No, he used to get very angry when the children did not work or when the servant did something wrong. Now he doesn't shout. He is very quiet. So what's happened to him? I don't understand. So he said, "We did nothing. He's just attending a camp for yoga and he's changed." In other words, the whole family changed. So that's why we say a yoga can change. If a person changes, it can change the family can change the community and so on and so forth. There can be peace. As Guruji was saying that there can be peace in the universe if you are having peace in yourself. So anyhow, I think the stress management is very, very important, and this has been shown. And there are a number of studies which have shown that stress control can do it. So these are four components which are important. But in yoga, I think research has been done for the last now 30 years. I started long back. Guruji also started at the same time. The first study that we did was on heart disease and all, and subsequently large number of, I'll just tell you because it's a age of science. In high blood pressure, which is a common disease, there are at least more than 70 or 80 randomized studies which have shown that it can reduce blood pressure, although to a small extent, 5 to 10 millimeters systolic, the upper one, and 3 to 6 millimeters in the diastolic. And this is a huge number. This is equal to any medicine that you know without any side effect. So it is, the research is so much that every society for hypertension control, or there is International Society for High Blood Pressure, International Society for Hypertension, ISH. They 2 years back they included yoga and meditation for the control of blood pressure. Listen, many patients have stress, and yoga and meditation should be done. Now the largest association of the world is European Society of Cardiology. They have also included saying that yoga and meditation should be used. So I think this has been one of the most important non-pharmacological. Actually, this is the only non-pharmacological method because it can take care of the lifestyle completely. It can change your diet, it can make you exercise, it reduces stress, it avoids, there are studies to show that it can de-addict you from the alcohol and the smoking. So there are studies on that also. And it can also reduce obesity, which is very important. It can improve your sleep also. There's no question about it. People who do properly yoga, they can sleep very well and all. And all this de-addiction courses are going on for digital de-addiction and all. I think yoga is one of that. But it has to be done properly, it has to be done regularly. It doesn't happen in one day that you can do it. So I think yoga has been shown to be extremely useful in high blood pressure, and every patient, I had many patients in which I have been able to treat high blood pressure without any medicine. And this is the medicine. Yoga is the medication, and many people call meditation as medication. So actually, I call yoga as a super pill or super drug for hypertension, because not only it takes care of high blood pressure, it takes care of other problems like a person has obesity. If a person is smoking, it can take care of it. The patient has diabetes. If it has abnormal, say, cholesterol, etc., it can cause marginally decrease also. So I call it a super pill, and it has no side effects, it has only benefits and all. So I gave a talk somewhere. I said yoga is a super medicine for high blood pressure because it has no side effects and it is as effective as a pill and all. And especially it's very useful in pre-hypertension. For example, if a person is prone to get, I said, 120 to 139, and there are studies, we did a study with the ambulatory 24 hours recording, and we showed that it can avoid the occurrence of hypertension. It has been shown in diabetes very well by a huge study done from S-VYASA. They have shown people who are prone to get diabetes, they can. So I think studies, as I told you, in hypertension are so many that this is included in almost all the guidelines, Indian to world. But there are studies, other scientific studies also. It can reverse even the blockage in the arteries. This was my project. We did show that people who had 80 to 90%, etc., they developed natural bypass. There was a decreased slight. But early blockages, you see, when the blockages start in the early stages, can be completely reversed. And we did that study also, in which we showed that by carotid Doppler, we call it, and the thickening of the arteries decreased. But even advanced disease, it can develop natural bypasses and slightly decrease it. So we have been able to avoid bypass surgery in thousands of patients, those who were asked to do that. And there's a huge study which was done, it's called Yoga Care, the largest study ever done. These are patients who had heart attacks, they had stents put in, and then half of them, there were 4,000 people, half of them, 2,000 were given yoga, and 2,000 were given the conventional therapy. And people who developed yoga who were given yoga in 2 years, they had less heart attacks, they had less other complications like unstable angina, repeat angioplasty, and so on and so forth. So quality of life markedly improved. This has been published, and as I said, one of the best methods of rehabilitation after heart disease, if you develop it, is yoga care. It is called yoga care trial. Now there is data to show that even in heart failure is a very dangerous disease. It's worse than even cancer, because majority of people die within 5 years, 50% die within. So this is worse than cancer, heart failure. And there are drugs, of course, available, but even with the drugs, the mortality is high. And now we did a small study in which we showed that heart failure patients also improve. But now this large study done again in about 16 colleges, more than 4,000, it's getting to be over within 6 months, and we will have the results. Yoga seems to be very, very useful. Yoga is very useful, and people have missed beats also, by arrhythmias, very fast beats and missing beats we call it. It has been shown it is extremely useful there also. So there are a number of studies in which they have shown that yoga is very useful in this. Not only heart disease, there are a number of other diseases like diabetes, I said, a huge number of, S-VYASA is the leader in this diabetes control for with yoga and meditation. A huge number of studies are there. It's also included in the guidelines that in diabetes also it's very, very useful and all. For obesity also we have done, there is a central obesity, people have abdominal obesity, and yoga is found to be useful. And they have shown that it improves even the insulin resistance, because insulin resistance is an important cause for Indians to get diabetes, heart disease, and so on and so forth. And so what we are trying to say is that yoga is useful in this continuum of why does heart disease or blockage in the arteries occur? Because of risk factors, what we call as diabetes, obesity, high blood pressure, anxiety, all those things are controlled. But even if the disease has occurred, early stages it can reverse. Even in the later stages, like heart failure, if there are arrhythmias, irregular pulses, or even a heart attack, after that it is helpful. So all my patients, after even if they get stent or something, bypass, they are given this yogic training. So what I believe, the scientific evidence is enough to say that everybody should do yoga. And even in the children, if they start doing it, their lifestyle will be much better. The habits will be much better. They will not develop the disease, because heart disease doesn't develop in one day. It takes 20, 30 years of our unhealthy lifestyle. It will improve our, I think, mind strength and the willpower, so that we are able to follow that. People know this is good lifestyle, but still they are slaves of the digital media and so on and so forth. So once you do yoga, I have seen that the mind becomes so strong, you think positive and you do change your lifestyle. Not only that, even if you are having severe disease, the medicine compliance is also much better. And even if you get, say, some surgery done, the recovery is much quicker. So it is now included in most of the hospitals, and now so-called integrative medicine centers are coming up in almost the whole world. And All India Institute is one of the biggest example where All India Institute and S-VYASA University have combined to do large number of research projects, and they have shown that it is not only useful for heart disease, diabetes, metabolic disease, but also neurological diseases. There was a big study done in migraine, headache. The cause of headache is mostly stress. So they have shown that in migraine also it is useful, and so on and so forth. So I think it is a simple process. It can sort of cover up so many other diseases which we know of. And of course, as I said, in anxiety, depression, this is the ideal. So I always say that if you want to remain healthy, if you want to lead a happy, stress-free life, do yoga. And you will not develop heart disease or diabetes or metabolic. Even if you have it, you can correct them in early stage without any medicine. But even if the disease is very advanced, with the medicines, if you combine this, you can improve. And in hypertension, I think this is extremely useful, and you can avoid drugs, especially if the blood pressure is not very, very high. So that's all I have to say. If there are any questions, I'll be very happy.
Any questions? Anybody can have questions, they can ask. You can ask them. It's online also if they have.
Yes.
Yes.
If any people have any question, they can ask.
Yes, please.
What do you think is the role of
Or
air
write down
pollution
Air
in
pollution.
heart disease?
Yes. Yeah, you're quite right.
There are studies being done.
Oh, yes,
Is that-
there are studies. No question. I did not talk in national because this we can't control. Yes, air pollution has a big role in the causation of cardiovascular disease. My colleague Dr. Prabhakar has clearly shown that it can cause not only high blood pressure, it can cause heart disease, it can cause lung disease, as you all know. It can also cause diabetes. We all know that it can cause lung disease, and all those people who are having allergic bronchitis, bronchial asthma, they just can't tolerate it. But apart from causing problem in the lungs, which we know that pollution can, it causes heart disease, it damages the artery, it causes high blood pressure, it causes even diabetes and all. So this is a horrible thing. Not only that, everything which is polluted will cause this. Now, even water is polluted. And there's a recent study which shows that, there's these plastic, microplastics. We take water in the plastic bottles. Microplastics can cause cancer, they can cause even heart disease. They are found in the arteries was blocked in the neck, and they found that the plastic residue, microplastics. So I think all the preservatives that we are taking, even in the vegetarian food, etc., especially in the fast food, they have to use about 300 chemicals to preserve that. The meat or whatever is there is preserved for such a long time, and to preserve all those things, they have to put so many which are dangerous and all. Like that's why we say fast food is very, very dangerous. Not only the fat, etc., but also the preservatives. So everything is preservatives. Even the gloves they are using, many of these fast food chains have microplastics, and they can be dangerous. Even the covering up of these things. I think we have to be very careful from the environment. Environment pollution is one of the main reasons for heart disease, but unfortunately we can't treat it. And studies have clearly shown, you're quite right, environmental pollution is important, and one should try to live in an atmosphere where there's no pollution, but unfortunately we can't control it. But what has been shown is that yoga, people are doing yoga, just like in COVID, people who were doing yoga, they had very little COVID, because immunity increases markedly. Similarly, lung problems also decrease markedly. Bronchial asthma, a lot of studies are there from all Indians from their center, is also markedly improved, because your vital capacity improves, lung function improves. So although we can't treat it, but we should try to try to live in those conditions where the atmospheric pollution is not there. Like Delhi is the worst. Dr. Prabhakar did a study from Delhi and Chennai, and he did show the differences. It's a beautiful research which has been done, not only here, but all over the world. It takes about, in Delhi, if you are living, it takes you 10 years of life. It has been clearly shown. So I think pollution is very important. I did not discuss it because we have no control. But yes, you are right. Not only it is the air pollution, but also the pollution in the vegetables and in the meat, etc., which are used. One should try to take as much natural food as possible.
Also, sorry,
Yes, please.
one I just wanted to kind of add to this, that One of the general perceptions about air pollution for people is that it's just affecting the respiratory system,
That's
whereas
wrong.
what it affects is the immune system,
Sure.
and it also changes the tone of the nervous system more towards sympathetic, causing hypertension. And
Yes.
so it's a response. Sorry, so since you have already addressed it, another constant discussion and a point of a question which has been there is that I don't know. I attended a lecture at AIMS where a very reputed doctor from UK had come and spoke about it. That the COVID vaccines, one of the side effects for that has been not COVID but the vaccines has been that it has precipitated the occurrence of heart disease in individuals who were already susceptible to it due to various genetic and lifestyle factors. Is it true?
Well, I think this vaccine thing has been investigated by ICMR in great details. Because this news did come that people are dying young and all that thing. It may be vaccination and all. But I think they did not find that people who had COVID, they had much more than the vaccination. Every vaccination has some side effects, for example, even if you take pneumonia, etc., and polio vaccine, small side effects are there. But the ICMR clearly shown that there is no increased incidence of heart attacks because of this thing and all. Yeah, I know number of reports are there in the Western countries and all, still going on. But the COVID itself was causing much more heart attacks. We have seen a large number of patients who were suffering from COVID, and those who had very severe COVID and that they got vaccination, possibly they also had much more incidence. There is something called late COVID now. Late COVID means after several years they are getting heart attacks and so on. Because the whole immunity system, we don't understand still the total COVID and all. But this is a late COVID thing, which means even heart attacks are occurring in those. But vaccination, I think at least the ICMR study, which they went into great detail, did not show. I think you should read that study from India itself. They have done a very good study and they have shown that there is no increased incidence. But those people who did not get vaccination, they had much more. So I think you have to compare that. So vaccination is not bad, I would still say that. But there is certain vaccine, the vaccine which was in India, but there are vaccination in US and in Europe which was different than ours. And that possibly has more side effects than what we had. Since vaccination in India possibly much better.
Someone.
Yes. Yes. Please.
Yeah, please. I'm Mrs. Timani.
Yes.
So I have a question.
Yes.
Means one of my English professor, I'm from education, so he was implied to me. He was in year 96, 97, right? He was operated on his heart surgery,
Bypass.
and he had lot of incidents in AIMS, right? He was from DPS Mathura Road. So after 1 month of surgery, I made a courtesy visit to him. So I found him taking liquor. So then I asked him, what are you doing? Then he said, no, it has been recommended to me by one of my AIMS doctor. And he said, if you just take this one, if you limit yourself for one pipe, right, it works as a thinner. And otherwise, more than one pipe and this, it is harmful. So what is your
that was
this is 96, 97.
I was there in AIMS only.
Yes,
Maybe he was
96. Mr. B. Das,
But
if I,
yeah,
you
yeah.
might.
No, but I never. The question is, yes, they were at that time. It was research was done. It was biased research because all these liquor companies, there were more than 100,000 papers on that, and 99 were by this. And they said that 2 pegs are all right. See, till 96 actually.
Yes.
Houston, if you know, the largest center where bypass was being done. I had gone there several times, and they used to take 2 pegs of scotch or equivalent every day. But clearly research has shown now that even 1 drop is bad. WHO has said even 1 drop of liquor is bad. That is all gone now. You see that earlier things were all biased studies. After that, large number of studies have been done, and it has been shown not only it causes heart disease, causes cancer. Actually, there is now many people are saying that they should write a warning there that liquor is possible cause of cancer. Just like you put a black dot. And it of course causes heart disease. It causes something called irregular heart rate, atrial fibrillation, which causes clot in the brain, irregular heart rate, even a drop. So I think the answer today is, the science today says you should not touch it at all. That one peg was wrong. It was based on some research which was really biased research and all that. So I think, yes, you are right. Hoster used to write it. We never wrote it actually. But my patients used to get it operated. They'll come here and they said, you should take it. That was completely wrong because research was biased. Now the research is clear. Almost all agencies, and WHO says, if you read it very carefully, is alcohol bad? They say even one drop is bad. They have clearly said this thing. So don't take alcohol at all.
Thank you.
Yes.
I have something on that. Let us see.
Yes.
Ask.
Yes, yes, please.
I think online question has been answered by sir.
Yeah, tell me.
But one question by my side. It's easy to convince the people, those are educated, and make them understand that alcohol is not good, and for the long term they may cause the cardiovascular disease or the things that might worse their condition. But for the people, those are middle and the lower middle class people, we make them convince, but they don't understand, and we will tell that your cognition will get lower, you'll start forgetting the things for a long run. But when we take the test, paper pencil test, any DSST test or psychological test, they are good at it, and they say we are good in this, and we are comfortable with our lifestyle. We don't want to change it, and we are not able to convince them because any visible evidence is also not in the favor.
You must tell them there are silent killers, you see.
Yes.
They don't cause any problem. For example, high blood pressure is a silent killer. Your blood pressure may be 170 by 110. You are all right today, but in the long run you will be bad. Alcohol may not cause any problem immediately, but ultimately you will get, as compared to your colleagues and all that. Do you want to? I think the way of convincing people who are not educated is much easier. I know, because you tell them some anecdotal things in their own. So, for example, own village itself. Look at this fellow is an alcoholic. He's beating his wife, and look at the atmosphere in the house. He's breaking the thing. Financially, he's completely gone zero because he could have used this money for something positive. So I think the ways of convincing have to be different, individualized, I would say. And as a doctor, I think we have to just tell them that these are the complaints which can occur. And you can take their own village, his own neighbor and all. You see, the best way to convince we find is, you see, when a patient gets a heart attack angioplasty, we have a class after that, before they are discharged. So we tell them these are the causes and all that thing. Then the relatives are also there. They also listen. And you will be surprised that about 40% of them have been found to have some disease. They've got their blood pressure checked up, cholesterol checked up, many of them have heart disease. So listen, they don't want to be like the other person who had a heart attack, who had such a big surgery and all. So I think the ways of convincing actually uneducated people is much easier to, as far as I am concerned. Educated much problem. Because the digital media goes on changing. Like he said, alcohol is good and all. Sometimes they say cholesterol is bad. All sorts of things come, which are, I think the Google doctor, we call it, is the most dangerous doctor. My Google says that all these drugs they are giving you useless. I can reverse my heart disease with this. All nonsense. It's absolutely unscientific, and it has killed many of my patients also. They say that all drugs they are taking useless, they will not take it, and many of them have died also. So I think one should also take the opinion of the scientific for the doctors and all. One should not go by the Google only, which many of the things are fake. And these days with AI, I think what will happen. But I think it's a way you can you have to convince them. The best way is if somebody is sick in the society and you tell them why. Don't they see in their own village? People who are taking alcohol, are they financially well off? No. You could have taken a car, you could, or whatever, something facility. Don't they see what is the atmosphere? The biggest cause of sort of so-called dispute in the family is the alcohol. These people come and beat the wives and all that. This is very common in the south and all. But I think one has to really convince them. There's so many angles in which I always ask them, you are drinking, do you want his son was 10 years, you want him to drink? He says, no, I don't want him. So it's bad. I give that example. I think the fellow was smoking. I said, do you want your son to smoke? He's 16 years. And they then stop suddenly. Do you want your son to take alcohol as a, no, I don't want that, but I want to take. Now this, so I think there are so many ways of convincing the people, and this is a very good method. You have children, yes. Do you want them to drink like that? They'll say no. They want that there should be fights every day, you should beat your wife, or all those things. This is the biggest causes of, I think, disputes in the family. And financially they are so bad off.
Yeah.
Then from there they go to drugs, they start doing crimes. So I think so many examples are there. See, as a practicing doctor, I have been able to convince people who are not educated much more. But you have to give examples, you see, or their own family or whatever it is. It's not difficult.
I have another question.
Yeah, please.
Thank you, sir, for your wisdom today, for sharing your thoughts. I just had one question. You mentioned that there have been times, there have been researches where the effects of hypertension and blockages have been reversed through asana practice. Are there any set of specific asanas or yoga practices which support this claim, or like is it a general practice which we are?
It's a general practice. You see, I'll tell you for few stretching exercises which we call asana. There's a gentleman in the United States who shows stretching can reduce your mental stress. There are people with pranayama who are talking a lot about pranayama can also affect. These two, both of them. But everybody agrees that meditation can definitely reduce these stress, and then it can improve all that. And that's why there are many methods of yoga. There are more than 100 methods. They talk of only meditation. For example, transcendental meditation. You must have heard of this Buddhist system, mindfulness meditation. Everything you do with mindfulness meditation. The Brahma Kumaris they talk of only Raj Yoga. That's also useful. The studies are done with only, maximum studies were done with transcendental, and they were found to be useful. Now people have done, but if you use all the three methods, that is little bit of stretching, little bit of breathing and meditation, then the effect is more. In hypertension issues, if you use all the three, there's a Mayo Clinic write-up recently, which is if you use all the three, then the blood pressure comes down by 10. If you use only meditation, it's by 8. And if you use the other two, then 1 each. So I think each one has a system. I think the holistic system, which is followed by them, and I also follow the same. But it's not necessary you should do all the asanas. It may be we are doing chair yoga now at my age. Yeah. I'm 85. Even chair yoga is good enough because you can do some stretching exercises. It's not necessary to do complicated asanas. If you are young, yes, you can do all the asanas. Every asana has some benefit, although we don't know the exact benefit of every asana. But we know that asanas do benefit. Surya Namaskar, number of studies are there which have shown. Pranayama also we know that it has benefit. But there are so many types. So you can't pick up 2 or 3, a teacher will tell you which one to pick up. So, but I think the best is if you do all the 3, but at least meditation should be done.
Meditation as well as breathing practices.
Yeah, yes.
Thank you so much for it.
And it is done. You see, I wrote in the first paper, people ask me how long you should do yoga meditation. I said 24 hours. While I am talking to you, I am doing meditation, because if you abuse me, I don't lose my cool, that is meditation. While eating, it's called mindfulness now eating. And there are a number of papers there. You know what people are doing? They are eating their food, they are watching the television, they are discussing the politics. That's absolutely not yoga, anti-yoga. While walking, I have seen, I walk in quick only, the gentlemen talk about the politics while they are talking, while they are walking. And the ladies talk their mother-in-law and father. So the question is, when you are talking about something else, you are not. So concentrate on whatever you are doing and think positive. That's what meditation is. So it's 24 hours. Even before sleeping, yoga nidra, you should do yoga. So yoga is a 24 hours. It's a change of attitude of mind. One of my patients, he got heart attack. He said, I'm doing yoga for 20 years. How did I get a heart attack? So I said, did you get angry? Yes, he said, that was common. So I said, you were doing it wrongly. So many people do it wrongly. So unless your attitude mind changes, you have to ask the teacher that unless your anger goes, all those things are negative emotions go, you cannot be really doing yoga properly. And it does come by practice. But a good teacher is important, and they people like them, very devoted, extremely good teachers. But it does come, yes.
We'll have the last question, then we'll go for some practice.
Yes, got
Yeah.
question. Yes,
Yeah,
My question is basically for the patients, like the early hypertension patients. So, like we see it's as early as 25, 30 years old, people are catching up with hypertension and taking on medications, going on medications. So, at times it is like pregnancy induced for ladies, as we see here. So, by the time they reach 35, 40 years of age, it's already 15 years that they have been on medication. So, what precaution should they be taking, and then how like frequently they should be going for a regular like checkup, or maybe a revisiting on the medication that they are taking, whether it is appropriate to be continued or no, and then what can be done to basically mitigate the risk which can come later in life because of like starting the medications early in life.
Well, anybody who has high blood pressure, we always ask them, this is a teaching, that they should try the lifestyle methods for at least 3 months or so, unless it's very high. For example, if the blood pressure is less than 160 by 100 or 105, you should try the non-pharmacological method, means no drugs at all. Exercise, diet, and meditation, and tobacco and alcohol stoppages, and reducing weight. If after 3 to 6 months now some people, you should then, if it is still high, then you should start the medication. And medication once started usually is difficult to take off unless the patient changes their life. I've stopped medicine in large number. It was said that if you start a medicine, you will take lifelong. No, not necessarily. If you become expert in meditation, yoga, if you are taking diet properly, and if you are reducing weight, yes, it can still be stopped. But if the blood pressure is very, very high, accelerated, say 170 by 110 or something, then you have to start medicine in addition to this immediately. Like you said, in pregnancy, yes, there is a problem. Those people who have high blood pressure, they should continue their medicines. There are certain medicines which are not given in pregnancy, I'm not going to detail, and they are likely to have toxemia of pregnancy. So pre-eclampsia or eclampsia, what it's called. In those conditions, you have to take medicine because it's a danger to the kid and all. But this occurs usually in patients who are already having high blood pressure, but it can sometimes develop because of incompatibility. In that time, you have to take medicine. You can't take only lifestyle. Lifestyle is important, but still you should take medicine. And as the pregnancy is over, then one can possibly stop them and change over to lifestyle. So lifestyle should be given a good try unless the blood pressure is very high. But in pregnancy, we give medicine because there is a danger to the fetus also. And that's called eclampsia, pre-eclampsia, and that can be dangerous.
Thank you. With that, we'll go for the practice. Yesterday we said at the body level, relaxation at the body level, slowing down of breath at the breathing level, and calming down of the mind at the dhyana level. So I request Dr. Manjunath to have the new dimensions for this. Dr. Manjunath is our Vice Chancellor in our university, as most of you know, and we have developed the new techniques by which you can do relaxation, even sitting on the chair also. So some of those things he is going to now demonstrate and we can practice.
Yeah, good evening. It's always good to stretch ourselves, as Sir has given enough indications that sitting for a long time without doing any physical activity itself can be an issue. Okay, we also talk about it's not an official condition, but there's a terminology called sitting disorder. Okay, so having said that, today for quick next another few minutes we'll do some chair-based activities. Sir is an expert in this chair yoga, okay, and he has been training not only elderly people but all other people in his community there. What we intend to do is what is needed not just for hypertension or diabetes but to maintain overall health. Fundamentally, we say that body needs some kind of stretch, and then the respiratory system needs to be once again stretched and relaxed, and at the same time your mind should be stretched and relaxed. So there is a stretch and relaxation at different levels, which can actually fix lots of the problems. So we will do today few of such techniques. We always do with a body-based stretch and relaxation. But S-VYASA, our Puja Guruji has developed some very special techniques for relaxation. Many people say that I don't have time for relaxation. Okay, so then there is a very nice technique called Yoga Nidra. Yoga Nidra you do, and it can be as long as 30 minutes. You can relax very well. When people don't have time, then we give guided relaxation, which can be for 10 minutes. When you don't have even 10 minutes, then you do something called a quick relaxation technique, which is hardly for 2.5-3 minutes, which is just breathing based. And life is going so fast, I don't have 3 minutes to relax. So then what do? You don't relax? No, you do relax. What you do is something called an instant relaxation technique. Okay, so you want to really relax after sitting long like this technique can be used. What we do is sit comfortably, stretch yourself back, push your legs a little forward. Okay, your back can be rested well and arms can be stretched on your armrest. Okay. So what we do in this technique is we start stretching our body from our toes to the head, okay, in single breath. So we do it very slowly. That means you have to breathe slowly. Okay, don't do too many breaths. But if you don't follow as per your breathing, don't worry at all. The purpose is to stretch first and then to relax. I'll just give a kind of a demonstration, then we will all do it together. Okay, so I'll be giving the instructions with fast. Like tighten your toes, ankle joints, calf muscles, pull up your kneecaps, tighten your thighs, squeeze your buttocks, exhale and suck your abdomen in, inhale and expand your chest, make a fist of your palm, tighten your arms, squeeze your face, tighten the whole body, tighten, 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 relax. Deep exhalation. Okay. We'll repeat it again. Once again. Okay? Be prepared. Start from your toes, relax yourself, take a deep inhalation and exhale completely first. Start from your toes. Tighten your toes, ankle joints, calf muscles, pull up your kneecaps, tighten your thighs, squeeze your buttocks, exhale and suck your abdomen in, inhale and expand your chest, make a fist of your palm, tighten your arms, squeeze your face, tighten the whole body, tighten, 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 release, let go, relax totally, let your head and neck relax, shoulders move down, do not hold it, relax your chest region, relax the abdominal region, relax your waist and hip region, relax your thighs, relax your knees, relax your calf muscles, ankles and the toes. Relax the whole body. Take a deep breath. Exhale deeply, as deep as possible. Inhale again, as deep as possible. Exhale completely. Last round, inhale deeply. Exhale. Gently open your eyes. Sit comfortably, but sit erect as far as possible. We'll do just another 2 or 3 breathing based exercises. Once again, we get bored, but we don't use our body much when we are doing chair-based practices. So you need to use your physical body to keep it active. Okay. Generally, we do a practice called hands in and out breathing. Okay, so generally we bring it in front and we stretch like this. But when you are sitting close to each other, generally you hit each other. So what we do is hand stretch upwards and exhaling we bring it down. But we do it very slowly. Okay. Breathe in and gently stretch your hands upwards. Stretch up. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Last round. Breathe in. Breathe out. Release slowly. Rest your palms on your thighs. Sit comfortably. Let your eyes be closed. Observe the whole body and relax. Gently open your eyes. Get ready for the next practice. Once again, hand stretch breathing. You need to lock your fingers. Keep them on in front of your chest. Now with inhalation, we stretch your hands, both the hands upward. Exhaling, we bring it to the same level. Breathe in. Pull the whole body up. Try to take it back a little. Breathe out. Breathe in. Stretch up and little back. Breathe out. Breathe in. Stretch up. You can look up. Stretch up. Breathe out. Breathe in. Stretch up and look up. Breathe out. Breathe in. Breathe out. Very slowly. Whenever you are relaxing, let your awareness be on your head and neck, on your shoulders, your back. Make your breathing as easy as possible. Let us do pranayama. First we'll do right nostril breathing, Surya Anuloma Viloma Pranayama. Inhalation and exhalation from the right side only. You can use a mudra, specific mudra. With your ring finger, you'll be gently closing your left nostril. Gently inhale deeply from your right nostril, as deep as possible. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. One last round. Inhale. Exhale. Gently release your hand. Just observe the flow of air from both the nostrils now. One nostril will be dominant at any given point of time. Observe it so that we can balance it. Use the Nasika Mudra once again. Now we will do left nostril breathing. With your thumb, you will be closing the right nostril. Exhale. Inhale and from left side. Exhale from the left only. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Slowly stop the practice, release your hand, relax the whole body. Just to experience the cooling pranayama. There are a couple of cooling pranayamas, Shitali, Shitkari, etc. But in a simpler way to experience it, we will do inhalation from nose, exhalation from mouth initially for 5 rounds. Then inhalation from mouth, exhalation from both the nostrils. Okay, first nose, exhalation from mouth. Slowly take a deep breath through the nostrils. Inhale. Exhale gently from your mouth. Just open your mouth a little bit and exhale gently. Inhale from both the nostrils. Exhale from the mouth. Inhale from both the nostrils. Exhale from the mouth very slowly. No strain, no stress on your breathing. Inhale from both the nostrils. Exhale from the mouth. Last round. Inhale from both the nostrils. Exhale. Relax. Now let us reverse it. Now inhalation from the mouth, exhalation from both the nostrils. Slowly inhale. Normally, you don't need to open the mouth too much. Close your mouth, exhale from both the nostrils. Last round. Close your mouth, relax. Now observe the dryness in your mouth, coolness in your throat. Now as you have closed your mouth, just gently try touching your tongue to the upper palate and keep it just touching the upper palate like this and close your mouth. Now inhale deeply from nose, exhale deeply from the nose. Let the tongue be touching the upper palate. Last round. Slowly stop the practice. Release your tongue. Now observe your mouth. Just stretching your tongue upwards increases the salivary secretion in your mouth. The dry mouth, when you inhale from the mouth, becomes wet when you do this simple practice of turning the tongue upwards and holding it. Just relax. Let us do one last practice, Brahmari Pranayama. You can do it in many ways. One of the simplest way of doing it is gently. Anyway, we'll be closing our eyes. You just need to close your ears. Inhale deeply while exhaling. Produce a humming bee sound or ma sound. Inhale deeply. Release slowly. After this round, slowly release. Relax the whole body. Observe the fine resonance of Makara or Brahmari. Relaxing the whole body. Let us chant Om 3 rounds. Take a deep breath. Make a cup of your palms, keep them on your eyes. Press your eyes. Just allow the warmth produced by palming. Relax your eyes. And gently massage your face. Relax your neck muscles. Just squeeze. And release slowly. Open your eyes with few blinks. Yoga offers us slowness. Yoga teaches us, brings that being slow in everything. That's why we keep on giving instructions. Gently, gently, gently kind of it, but the mind runs very fast. Okay, we have an urgency, I want to open my eyes, I want to do many things very quickly kind of it. But when you come to yoga, when you are practicing yoga, just give that extra time to yourself. That's the beauty of how we have to practice. And particularly the last practice we did, Bhramari Pranayama, Guruji has designed a fantastic tool out of it, a measurement tool called Bhramari time. If you want to test your lung function, then Guruji said that you don't need a peak expiratory flow rate meter or anything, and forget about spirometry or anything. You just count yourself. Take a deep breath. When you do, how long you can do, just time it. If you can do it for 30 seconds, it's very good. If you can do it for 20 seconds, listen. If you cannot do beyond 15 seconds, then you strictly need to do yoga. Okay, pranayama. Otherwise, there is something you need to fix. As simple as that. Okay, because in yoga we emphasize a lot on exhalation. Okay, cardiologist sitting here, we know how sinus arrhythmia works. How when you inhale, heart rate goes up. When you exhale, the heart rate comes down, slows down, etc. So we have to just use physiology to manipulate and bring your health back. That's the whole purpose of it. So just Guruji asked few techniques on the chair, we thought of doing it. You can do everything. You can even do Surya Namaskar. There is chair Surya Namaskar, which everybody can do. Those who cannot do it on the ground, at the same time you can do all the postures. Most of the postures can be done. But when you have the luxury of doing it on a mat, please do practice them and get the best benefit of it. Okay, thank you. Namaste.
Close with Shanti Mantra.
We'll conclude with the Shanti Mantra. Sarve Bhavantu Sukhina. We can all chant together. Okay, bring your palms together in front of chest. Take a deep breath. Sarve Bhavantu Sukhina. Sarve Santu Niramaya. Sarve Bhadrani Pashyantu. Kaschid dukkha bhavet. Om Shanti Shanti Shanti. Release. Thank you. Thank you very much. Have a pleasant evening.